So you know that I have such a preventative approach to your oral hygiene, and we really have to remember that your mouth is part of your body and that it really does have a really critical effect on your overall well-being. There's so many studies that relate poor oral hygiene and bacteria in your mouth with heart disease, Alzheimer's, and most recently studies are coming out about male and female fertility when you actually have inflammation because of bacteria and gingivitis in your mouth. So I find that really interesting. So I'd like to take the time today to just show you how you can look after your oral hygiene. So obviously, you know, the most important thing that you can do for your teeth is to brush them. So brushing morning and night, you can use an electric toothbrush or a manual toothbrush. Electric toothbrush is pretty self-explanatory. You know, usually they have timers, they have pressure sensors. But for those of you who are using the manual toothbrush, I think it's really important. This is a little dental model. So I think it's really important that, you know, we get out of the habit of doing this because we are keeping our teeth for longer. And as we keep our teeth for longer, we're actually needing to preserve the enamel. And if we're brushing side to side, it's just too abrasive. So this is a really nice little soft brush. And what we're going to do is we're going to put the bristles of the toothbrush into the gum at a 45-degree angle, and we're going to brush in a very slow circular motion. And then just work your way around all of the teeth, top and bottom. I find, you know, when I get, we don't tend to do oral hygiene instruction in adults. Sometimes we need to, but when we do it with kids, the first thing I see them do, if we look at this model, the first thing I see them do is close their teeth and do this. And so what they're then doing is just brushing the tips of the teeth. So I always say to the kids, you really need to open your mouth. So you're going to open your mouth and you're going to brush the lower teeth first, and then you're going to brush the upper teeth. So you brush the upper and lower teeth very independently and separately of each other. And so, you know, you're working your way around doing the little circles with a soft toothbrush at a 45-degree angle. Then you come into the lower front teeth. The lower front teeth are notorious for building up tartar because in underneath the tongue, so the tongue would be here in this model, in underneath the tongue you have your saliva ducts and the little glands where the saliva squirts out. So that tends to be where you get the most concentrated amount of tartar because of the anatomy. So it's really important that your brush is small. I always recommend, you know, use a small toothbrush. You have so much more dexterity and manual control over a small toothbrush as opposed to a bigger one, and it actually makes you work a bit harder. And if you think, you know, your tongue is in here and you've got a big toothbrush, you're not going to get right down to the gum line. So the most important thing is to get the toothbrush, the bristles down to the bottom, little circles, and I think just flicking like that. So that's toothbrushing, pretty self-explanatory. Now also remember that when you brush your tooth actually has 5 surfaces. So if we take this central incisor here at the front, for example, you have the surface that's along your lip, you have the biting edge of the tooth, and then you have the roof of your mouth surface. But let's not forget about the between the surface. So you have the front inside and the side here. So you have technically 5 surfaces on your tooth. So if you're brushing the lip side, the biting surface side, and then the roof of your mouth side. But that is 60% of the tooth that you're brushing. You're not getting between the teeth. So that's technically 40% of the tooth that you're missing out on. Which brings me on to my next demo, which is either to floss or to use pixter brushes. A lot of people don't know about little brushes that go between the teeth. They're quite soft. They have a metal base, and then they have these little bristles. And they technically just sit between the tooth like that. So you push them in between the teeth, like this. And obviously you need to just find the right size, but I can help you with that at your consultation. And then the other thing that I like to do, if people are really struggling with their oral hygiene on the front, on the lower front, you can actually put the pixter brush from this angle, from the inside angle. So you're actually contacting those teeth a little bit more. And then the other thing that you can use is floss. So floss is just a string that goes between the teeth. How good it would be if patients can all just open their mouth like that and flip their lips up, and how wonderful. But, you know, for all intents and purposes, you're really just getting the floss up between the teeth. For each space, you actually have to floss twice. So you're flossing up the front surface of this canine tooth here, then you're bringing it down, and then you're flossing up the back surface of the incisor tooth, and then bringing it back out. Not sawing. A lot of people tend to do this, like they actually get the floss and saw. You could be destructive on the gum attachment there, so don't saw. And then the other really important thing that I think you can do to keep your teeth healthy and resist decay is that when you brush your teeth with a fluoride toothpaste, you actually don't rinse it off with water. So you spit. So it's like you brush and spit into the sink and don't rinse with water. I do find that that's probably easier to do at night, because obviously during the day you're going to start eating, you're going to have a coffee or, you know, breakfast. So I think doing that at night, the guidelines from some of the studies in 2019, back in November 2019, suggest that it's a really beneficial thing to do. And I think that all of those things will help you keep your teeth clean. Obviously having a checkup every 6 months is important, so then we can, you know, flag potential problems for the future. And just watching your diet, just watching the sugars and also the frequency of when you eat. So yeah, so I hope this is helpful and look forward to seeing you soon.